What's up, guys? I am back today. I'm going to have my elbows worked on. I'm going to have something done called the Graston technique. If you have elbows that are sore, tight, what have you, this works really, really well. I had it done, what, 4 months ago, maybe?
Oh, yeah, probably about 4 months, yeah.
And I'm in way better shape now than I was when I had it done. But I feel like it's time for a little touch-up. This man right here, Dr. J.
Hello.
If you guys have not had a good chiropractor, this is a good chiropractor. And anybody who tells you that chiropractors don't work have either never had a good one or never been. I'm telling you, it's a wise investment. This guy is worth his weight in gold.
Appreciate that.
So I'm going to let him get to work. He'll explain to you what he's doing and why, right?
Absolutely. And so what we're dealing with is called lateral epicondylopathy, or tennis elbow, and really what brings on this pain. It's pain on the outside of the elbow, and it's brought on by typically doing a lot of gripping things, just repetitive overuse. When you're at like Safeway or check stand, you see the checkers that are wearing that kind of band around the arm there. It's because they're doing this motion all day long, so it's a repetitive overuse. And a good technique to help out with this injury is called Graston, or instrument-assisted soft tissue mobilization, the long-term name for it. And what we're doing is just kind of stimulating some blood flow to those tendons that attach into that point of the elbow here. It's not the most comfortable feeling, but it is very therapeutic. And so takes about a minute or so. And yeah, we're just going to get
And this man has stronger hands than you can imagine, trust me, because he's going to squeeze on me.
Yes, we do. And so we're going to put that muscle on stretch just like that.
So why do I have this? I don't play tennis. Is it because I'm old?
Not because you're old. Just because you age doesn't mean you have pain, but you do a lot of gripping things. And so what we're going to be doing is just kind of stimulating some blood flow into this attachment site here. And it takes about 30 seconds or so.
I've been known to grip things in the gym here and there.
As you can see, he's got very strong forearm muscles here.
Not as strong as his hands.
Like I said, it's not the most comfortable thing in the world, but it is pretty darn helpful.
You're not lying, but it sure does work.
Just go to your happy place, like the gym or the beach in
I
your
know I'm on the
mindset.
beach. There's an athletic woman laying next to me.
There we go. Now we're talking.
And she's not yelling at me. Oh, this is paradise. Happy place.
Yeah, don't leave yet. And as you can see, it's starting to get a little red through here.
What do you think?
Just a little bit. Nice and gritty in there. And what I like to do after we do this Graston is, it's called active release technique. It's a manual therapy technique that I use with my thumbs and my fingers just to give a little bit more release of those muscles on that attachment site there.
That's where those strong hands come in.
And so this muscle goes from actually the inside of the wrist here, and it goes all the way up right in through here, and you can see that muscle that we're working with here.
I'm on the beach.
Okay, that's pretty good.
So what's new in your life?
Just working and traveling.
Where'd you go last? This guy's always on the road. He's like the traveling chiropractor.
Let's see, I was in Arizona, and I was in Mexico. I leave for Honduras in a month.
Good.
Well,
You're always
actually,
up to something.
I got a half marathon in Bend next month, and then that's April 10th, and then a couple weeks after that, go to Honduras for my 30th birthday to get my scuba dive certification.
Dude.
Yeah, I don't think we've talked about that.
No, this guy's a master of all trades.
So you're going to start with your wrist here. We're going to start here, and we're going to work our way all the way up here. So we're going to hold there, bring your wrist all the way down.
Strong hands.
And all the way down, all the way down. Good. And back up. And down. And back up. And down.
You gonna ask me about my foot drop? You saw it.
I did. Yes, I was actually the one to diagnose his foot drop injury that he had, and
it looks pretty hopeless, didn't it?
yeah, it was not a good prognosis for us all the way down.
It's pretty good now.
But after just a couple weeks and doing some kind of at-home supplementation things that you were doing, got that foot to start working again.
There's a lot that they don't tell you.
Oh yes.
5 weeks, I think it was.
Yeah, which is normally it could be like a 5-month to a couple of years.
I had a buddy that had a pretty bad case. It took him a year.
And one more.
His hands have gotten stronger. Or I've gotten frailer.
I don't think you've gotten frailer, that's for sure.
I'm getting old, man. Alright. I'm going to do the other one, don't we?
Yep, halfway there.
Halfway's the
We use this, it's called rock rub. It's just an emollient, just so it doesn't irritate the skin.
God, it's already loose. I mean, it
Loosey-goosey.
moves better.
Now you're ready to hit the gym.
We're gonna go eat, and then eat again, and then hit the gym.
Nice. What are we working out today?
I'm doing triceps and what am I doing? I'm doing triceps and hams, I think. And he's doing quads. We're gonna make him do some hack squats tonight.
Ooh,
He's
now we're talking.
probably not happy with me. No one likes doing them.
Where do you guys work out at?
24 usually. I did squats on Saturday. I'm still jacked up. Dude.
Doing front squats, back squats.
You know, honestly, those don't really make me sore, so I do a lot of hack squats and V squats.
There you go.
Hack squats really, really, really make me sore. I don't know, it's something weird about my body.
It's nice to switch it up, not do the
Yeah.
same exercise.
You know, sometimes if I have to go to Sim Fitness, Planet Fitness, as a backup. Now, 24 is 24 again, so that doesn't happen, but, you know, all they have is a Smith, so I'd have to do the Sim squats, and
That's funny.
it kind of worked. In a jam. You know, you gotta do what you gotta do, baby. I used to do a lot of one-legged dumbbell squats, but turns out I don't have balance anymore, so
Well, that's always something we can improve on.
there's that. Get the redness going again. It's already looser,
It's
man.
that blood flow.
Yep. I will say this is more effective than peptides, although peptides work wonders for blood flow.
Agree with that.
BPC 157 and TB 500 can't beat them for healing.
Yeah, we did talk about that.
When I get my surgery on my hernia that I don't want to get done, I'm going to be living on that stuff because I don't want to suffer any longer than I have to.
Up here. And bring it down. And back up. And down. And back up. And down.
Strong hand, man. You got stronger. He's lying. He's lying. So if you guys need a good chiropractor and you live in the Portland area, first of all, I'm sorry. Not that you need a chiropractor as much as where you live. And then Milwaukie Chiropractic on 37th and International, right?
Yep.
Yeah, that's right. 37th International.
I'm Dr. Tanner Johns. My father is Dr. Keith Johns. He's the owner of the practice here and been here for 32 years.
Can't speak of his old man, but I can tell you this guy, he's awesome.
And bring yours down. Good. Alrighty.
How about a quick neck and back? Yeah?
You betcha.
Let's do it.
Alright, so what we're going to do is we're going to have you lay on your right side for me.
Get this out of the way. Like a stanza wallet.
And we're going to bring this leg straight. Tuck that here. Pull this shoulder under you. And relax that hand here.
Yeah, I'm actually down about 20 pounds.
Look at you, you're skinny now.
No, not at all.
Big deep breath in for me. And check that other side for me.
I've got about like 20.5, 20.6, I think. Gotta get ready for summer, dude.
There you go. Get that beach bod going.
That's what I'm saying. Ooh, it just popped when you did that.
Freebie.
Freebie. I've walked in here and just hunched over like,
Oh, we've seen you have some bad days.
I've been in bad shape before.
Big deep breath in for me.
There it goes.
Good. And lay flat on your back for me. And bend both your knees.
I always forget that part.
It's all good. And scoot down toward your feet.
Teach a little dog.
And you're going to reach all the way up and across. Flat hands, just like that. Raise your head up here. Deep breath in.
Oh, yeah. That was a good one.
And one more deep breath in. And breathe out. Good.
That was a good one.
And
Oh, that was money.
work on your neck.
That was good.
And relax your arms by your side. And bend both knees.
Told you guys, I forget that every time.
As long as I know what I'm doing, that's the
Someone's got to. Telling you. Just blindly go throughout the day. I don't know how I make it.
Okay, we're just going to give a little bump in this position here. Bring that shoulder down a little bit. Good.
Ooh, yeah. I bet the camera's not picking that up. Man, that was good.
Good over there.
And you probably want to check my feet to make sure that you'll ask usually. You want to see it?
Yep.
All right. So it was this one, right?
Yes, it was. This was the one.
Look at
foot
that.
he was not able to lift up. We did a little test on him to see,
That was
check
bad.
the nerve strength that supplies the feet. So we had him try and do this. And
How often do people try to do that?
unless they
I
come
failed
see me,
miserably. Now look.
I was able to walk on through that
Look at
and
that.
repetitively do it as well.
Bam, bam, bam. 5 weeks, guys. If you have foot drop, reach out to me. I'll tell you what I did.
There we go.
Thanks, Doc.
You betcha. Good seeing you as always.
You too.
All right, nice meeting you. I'm Dr. Tanner Johns at Milwaukie Chiropractic Center, and this is Aaron. If you ever need some exercise tips and how to get swole, this is your guy.
No, I don't know about that. All right. Thanks, Doc.
All right, you betcha.